All right, good morning. Welcome back. Um, we have a excellent presentation for you today. Um, and we know you could have been in other places, but you're here. Thank you to our sponsors, Office of Global Exchange, Global National Exchange, Chancellor's Office, and Kipuka. Any other ones? Um, Reminder, please do the QR code. We'd like to hear your opinions, but it also helps us to secure funding for next semester as well. So today's presentation is about a very important issue to our community locally. And to talk about that, we have Brandee Menino talking about from home services, Hilo home services. So, without any further ado, I think she has a video for us first, but
In the past year, we've witnessed the power of faith, community, and collaboration come to life through a few new initiatives. We celebrated the grand opening of the Sacred Heart Affordable Housing Project in Pahoa, our first ever housing build, and welcomed our most vulnerable seniors into safe permanent homes. Partners from our faith community, private businesses, and nonprofit agencies extended their hands and hearts, strengthening our mission. A soft blessing commemorated a new partnership with Our Lady of Lourdes Catholic Church in Honaka'a. Kapuna will soon seek refuge and healing in this space as they move off the streets and into supportive housing. Our integrated care hubs and medical respite services offers individuals exiting our local hospital places to go for continued healing. We continued our psychiatric street medicine services and launched the Assisted Community Treatment Program to help individuals who are unaware of their serious and persistent mental illness and help them access the treatment that they need to live full, quality lives that they deserve. We purchased nearly 24 acres in Mountain View this past summer and promptly began pre-development activities as we prepare to build our second community village. And through the Hawai'i Leadership Academy, we've trained the next generation of leaders from across the state of Hawaii, grounded in our shared values. Together, we are fulfilling our call to serve and uplift, guided by faith and driven by hope. Aloha, everybody. Thanks for being here. Aloha. So my name is Brandee Menino. I've asked to come here as the representative of Hope Services Hawaii to talk story. So we're here to talk story. But you're gonna listen to me for like about 15 minutes. I'll try to go through some PowerPoint slides. Hey, Kevin. And then we'll do some breakouts. We have three prompting questions that for y'all to break out in small groups and then come back together at the end, towards the end of the hour, is kind of what we have prepared for today. So, Hope Services Hawaii is a nonprofit organization in our community. We are an affiliate organization of the Roman Catholic Church. Hope Services has been in existence for the last 14 years as its own nonprofit, but it gave birth through the Catholic Diocese. Previously, my predecessor and Professor Okinaka mentioned my predecessor, Cara Ignacio. She was the founder of the Office for Social Ministry, and that office created the food bank, Mobile Care Health Project, and Caravan. Caravan was the department I ran, homeless services, and then the bishop at the time established Hope Services as its own nonprofit. But we don't do this work on our own, and that's why the last bullet point is that we're part of a network of organizations in our community, other nonprofits doing this work together in community with faith groups, with businesses, and certainly the university as well. I wanted to share some statistics. And like now I'm all panicking because you got the professor that used to teach statistics in my generation in here. So I'm not here to teach statistics, but at least I can show an image, right? So we do work with nonprofits actually across the neighbor islands. When we prepare and apply for federal funding, HUD, which is the Federal Housing Agency, sees Hawaii when we apply for funding as two communities for homeless services. Oahu, which is Partners in Care, and then the balance of state is what they call us. So, which is Maui, Kauai, and Hawaii County. So the neighbor islands work together. We meet once a month to talk through trends, patterns, what's happening on the ground, like what was happening with our fire when we responded with the lava eruption. So we share practices and concerns and issues across the neighbor islands. And one of the activities that we do as a nation is called the Homeless Point in Time Count, and we share that data annually. And I know there was a she had participated, one of the students here, in last year's count. So we do solicit volunteers from the community, from the university, whoever is willing to walk alongside of us as the nonprofits to do this work. So there's really two data sources we pull for to share that information with our state legislators, with our county council, with our team members. And one of that is the homeless point in time count. It's really depending on the capacity you have on the team that year, is really how much of a reach we have counting individuals island wide. So the numbers I share with you is, with that assumption is what our capacity. So, oops, there you go. So it's on the bottom, which you can't really see, but each point is by year, and the last year on the far right is 2024. So, I mean, it is a political year, so you'd often hear Mayor Mitch Roth say there was a decrease of 36% in homelessness. But as you can see, when he first got into office, it actually went up. And that's why it went down. But if you saw it go down, it's really relatively the same in the last years prior. So when people say, Brown, it doesn't look like it decreased, I go, yeah, because it didn't, but it's whatever data you share. So it looks like you did because from year to year, it looks like you did. But if you look across, which our statistics professor would say, you got to look at trends throughout the years. Yeah, look more than 5 years, 10 years. But our legislators like to hear kind of a point in time every year. So what we counted, we're able to count was 718 people throughout the island. Of that, 527 were unsheltered, so they're there in your cars, on the beaches, at the parks. And then sheltered homeless are those who are in facility, right? They still don't have a permanent place to stay, but they're staying in either our shelters or another nonprofit provider. So you add those two up is the 718. The other data that we collect is our annual data. So it's gonna move forward and then move back. Then you'll come up. We have annual data. So when I mentioned that the neighbor islands work together, is because we have the same shared database. So we're able, whenever you come into any one of the organizations doing this work, we're using the same intake form, the same assessment forms, asking the same questions uniformly across the neighbor islands. And then we enter that information into a shared database and get to collect annual data, demographics, whatever they're sharing with us, we get to put that in our database. And there's really three data metrics that matter to us, which is of those, the number of people we serve, how many of them are leaving our system and going into housing? And our data is showing us in last year, those we served, 73% exited to permanent housing, which is super awesome. Because across the state, it's like 35%, but ours are trending higher because of new investments in our community county council. We were able to do some new innovative things in the last year. So that's improved. It wasn't like this 5 years ago. It was our data was also at 35%. So it's improving and we're moving in the correct pathway. The other data metric that we look at is the length of stay that they're with us, right? We don't want them to stay with us in our shelter for a very long period of time. Our state measures that as 90 days. Like our goal and our target is to help people engage with them on the streets, get them into shelter, and then they kind of start the clock of our enrollment date. And then we try to get them connected to help and services, but really focusing on housing. Really, so we changed our outreach staff, their titles to outreach staff, to outreach workers, to housing navigators. So then they could be clear that we're here, you're on our team because you're helping people navigate the housing system. So we really want this number to be, zero, right? We don't, you come in with us, you're out into housing. But right now, when we look at our data throughout the year, our average length of stay is 119 days. So we're still working on that, trying to make sure people can find housing. But as you all know, housing market is really tough and hard, finding affordable places for people to stay. And then the third data metric that we look at is how long people are staying in housing. So we provide follow-up, but either by phone call or by phone home visits to see how they're doing and whether or not they're staying in housing. So what we found when looking back the last 2 years, the people we've housed, 91% of them are staying in housing. And then we're often asked for demographics, kind of who are we seeing? And so we try to put that in infographic. And all of these images actually can be found on Bridging the Gap or btghawaii.org website. That's the name of the neighbor islands. And we have all these dashboards. So I didn't make these up. I just downloaded it and then put it on the Mentimeter. Oftentimes, these are the demographics people ask me. So these are the ones that we put up here. So of those we served, how many were veterans? They're at 6%. Our kupuna is increasing. We're at 12% of the people are serving. And kupunas, I don't make the age limit. So they start kupunas, they define kupunas as 62. I'm almost there. I don't think I'm a kupuna. So but the age, federal government calls it, is 62. And then the other question I'm often asked is like, oh, how come so many people are coming to Hawaii? Like, I only see new faces. But our data shows that, it's majority of those that we encounter and provide help to are residents of Hawaii 20 plus years, 10 plus years, 5 plus years. When you look at how many of them have been in Hawaii less than a year, it's just 5%. And I think there's large differences from like Hilo to Kona because of the airport, right? We don't have any national airplanes anymore coming to Hilo, right? Versus Kona side. And same thing across the state, right? So wherever you're gonna see more tourism, Maui, Honolulu, you're gonna see that numbers be higher. But as a county, that's what our data shows. And then, families, people ask me about the family datas and what does that look like? And so, especially for Neighborhood Place Puna, one of our partners, so we look at it. So, of the people we've served, and I think that number is all the way at the top, 705, 33% are children. And of the children, 39% of the children are under the age of 5. So, these are young families, you're saying. And then when you talk about family makeup, 74% are led by single mothers. Yep. And then just in general, 26% of the families are with children. And then we like to look at what are some other environmental stressors. So, because when people think ending homelessness and working towards that is complex, right? There's so many things that's happening. And one of that, as we talked earlier, is the housing market and what's happening with the housing. Because I'll preach like we just got to buy and build, buy and build. And a lot of feedback you'll get is like, well, what about all the housing that still exists? There's inventory and what's being done about that. And so we looked into that. And actually, the state publishes a report, the Budget Policy Center. And as you can see, I think it's really tiny. This one and the next one, the data is based on 2017 to 2020. So they're working on a more updated report. But based on that data, we looked at the vacancies of homes in our community. So second homes are left vacant, new homes are left vacant. And what does that look like for Hawaii County? So in the national data, 12% is homes are being left vacant in the United States. In Hawaii as a state, 15%. But it's even worse here. So we have homes empty, vacant, 21% of homes are left vacant. So yes, there is inventory. Second homes. So people are like from away, they buy homes here, they stay here for a couple months, but they go back and it's left empty. And construction. And who is buying our homes? So this was interesting, also from that same report from 2017 to 2020. So in the state of Hawaii, the average who is buying our homes, let me move forward and then go back because you'll see. In Hawaii is 42%, or in the third graph in the middle, 42% is non-residents. Yeah. If you compare the neighbor islands to the city and county of Honolulu, just 13% is Honolulu. But as a state average, compared to our state average, which is 22%.
So you have all these stressors in the rental market that's happening, right? And affordability. I mean, I skipped that slide because you guys know as you live here, the, the affordability of here and on what you got to make compare, what you make compared to the housing wage and what it costs to rent and or to buy. So I skipped that slide, but then I think the one part of the conversation we wanted to pivot is what's available in our community. So part of my work is not just being chief executive for a nonprofit, but working with other nonprofits. And we live on a big island, but it's really a small community of nonprofits. And there's a lot of work because there's a lot of deep needs in our community. So we don't have the capacity to do everything, right? So we want to make sure we're empowering our agencies that work on domestic violence and do that well, and do they have the resources? Folks who are strengthening families, making sure that they have their resources, and folks who are working on reentry and people coming out of prison, that they have resources. People who are working with immigrants, that they have their resources, because all of this leads to and compounds the field of homelessness and why the causes: family conflict, domestic violence, poverty, not enough rent, not enough income to sustain rent or buy homes. um, but I went to this one community in Texas, and he said this, and I was like, "Ah, I like that." He said, actually, the number one leading cause of homelessness is the catastrophic loss of family. Because that really made me think about that. Because I was like, I mean, people like for myself, I have a family. When I was a 19-year-old single mom with a baby, I had my family that I could go back to, get help, watch my baby so I can continue to go to school, get my education. So I had family. People, most of us will have family, but then when you're working with people who are on the streets, family gave up. And not that they did that the first time, probably like the 100th time, right? So they lost their resources with family, health deterioration, their health bills and accident. There's so much reasons why it leads, and that's actually going to be one of the questions you guys are going to talk about. But we're going to talk about services and resources. So I wanted to just demonstrate that, again, we just had a leadership academy. We helped to host, build our capacity as a network across the state. So they like coming to Hilo because they feel when they just come off the plane, right? We chill, we relax. Feel like, calm down, slow down, because wherever they're from across the state, it's always like the next hustle, right? So they said, Brian, can you host it again? So we did that at the Grand Aniloa. This was about 120 leaders and emerging leaders doing this work across the state as we think about succession, but also inviting our government partners, our nonprofit partners, people of lived experience. And then we invited national speakers, national experts, because oftentimes some of us were able to go to national conferences, but not our smaller nonprofits here. They don't have the budget for that. So we wanted to bring that experience in Hawaii for the people that's doing this work. And there really is what you heard in the videos about shared values, paddling in the same direction, being in the same canoe. That's really what we were trying to do in trying to bring together our nonprofit organizations. And here's just a sample of the nonprofits in our community doing multiple things, from coordination centers and health services to reentry work. And I will mention some of these folks along the way as I talk about what Hope Services does. I will also mention other organizations doing the same similar work. Wait, yep, sorry. So the work that we do, how they enter services, whether it's our agency or other nonprofits that are operating outreach teams, we go to where people are at, where they're living, on the streets, on the beaches, at the bus stop, at the bus depot, um, in other people's homes, because they let them pitch a tent in their yard for temporarily, and they go, Brian, we really need them out now. Like, can you help us help our family member move on, or a friend or somebody I brought home from the street? So like whoever calls, and we used to be the single number, but actually with the county resources, we actually now as a system, uh, focus our calls and our who we encourage the community to call the coordination center. And the coordination center is managed by Neighborhood Place of Puna. So since this is an interactive conversation, if you have your phones, see, I just assumed everybody in class have their phones. So I wanted to do like a Google search for Neighborhood Place of Puna. Yeah, take out your phones. Yeah. Go neighborhood place of Puno. Those of you who have cell phones. Because if you do that, neighborhood place of Puna, you'll see the link for coordination center. Another way you can Google that is put coordination center, Hawaii County was the other way I tried it. And then neighborhood place of Puna popped up. But we only got one bar. So, yeah. Oh, yeah. But I just got it. So let's see if you guys got it. If you find it, you'll see right on their page, right, their first landing page, the coordination center. If you scroll up, you'll see call or text, and it has the number 808-501-1413. Right below that, it has the button where you can put submit an assistance request form. So you can click on it, fillable form. So there's multiple ways you can get in touch with this coordination center. It's only been in existence for the last year and a half. So help us get the word out. So it doesn't mean it's not limited to homeless services. It's you have a family member, a friend, a neighbor, they're in need, they need help, and you're not in social services, you have no clue where to start. This is where you start, the coordination center. Before there was, I think we used to promote the Hawaii Island United Way and the Aloha United Way and the 211. And the 211 is also great, but they're managed on Oahu. So if you're looking for something that's, information is kept up to date and live, and you get a live person that knows our island, the coordination center. So that's why I put the 2 asterisks, because that's really now where we encourage callers that need help or family members to call that number. So hopefully you're able to get that. If you continue to scroll up, see we're really good at data. They're like live information of like number of families served. Like you see the numbers moving, number of calls, and all the assistance, what kind of assistance people are requesting. Yes, 5 years ago, you wouldn't think social service was really into data. But we were like, we're full on focused now, trying to figure out like what's happening in our community, like what's the gaps in services, what's the high need, and then are we providing that service for our community? So, yep. So this is with the County of Hawaii's resources recently. But so you can call that center, and you may say, okay, I'm on shelter, I need help. There are 5 organizations now doing street outreach. We're one of them. So there's Project Vision Hawaii, Going Home Hawaii, um, Hawaii Island Community Health Center. Well, I count them as 5, as 2, but they're mostly island wide. So they have a team in the Hilo side and a team in Kona side. And then there's 808 Task Force. But there's multiple of us, is what I'm saying, and Salvation Army for Youth. So we all enter information into the same database as a Hui, so then we can see and have a conversation. And of course, that's with consent from the person we're talking to. And that helps us continue the conversation because of the transient nature of the population. So if we see John today, but John's actually working with, we can see Project Vision Hawaii, we can see her last note. Like she received his photo ID, his driver's license. Then I'm talking to John. I'm like, hey, John, Project Vision, Renee with Project Vision has your photo ID. You want to pick it up today, or you want to give her a call? Let's give her a call right now. So then when we're working with other organizations, it helps to improve our collaboration and our work. And again, new because of the new county resources. Through the outreach teams, some of us also have street medicine teams. So really that's during COVID, we saw the need of like having healthcare professionals on our team. Started off with registered nurses. We've always had our relationship with the university and the School of Nursing. So we've had students come through our programs as well and internships. But now since last year, we contracted out a community psychiatrist. So Dr. Chad Koyanagi flies over from Honolulu because he does this work on Honolulu twice a month. He's also a locum psychiatrist in the Kona side for the Kona Community Hospital, so he's familiar with our community. But he's been doing this now for a year and a half in Hilo. So helping folks in building relationships and seeing if people will take medications voluntarily, and if not, then we figure out another plan to get them on a pathway to access that help that they need. Also with that, we were able to do other services besides outreach. And these are just a slide of like the areas. And I mean, you guys all know live here, so you can know the vast geography we all have to engage. But these are all kind of the names to the different regions. So it is outreach island-wide among the 5 nonprofits. But people need places to go, safe places to go, right? We want to offer them hope. We want to offer them help. So besides trying to meet their immediate needs with food, snacks, water, or tending to their wound, we try to create places and spaces where people feel safe. So part of that is emergency sheltering, and through our emergency shelter and healthcare, we are able to build out from at 3 separate locations, 18 beds of medical respite. I think a couple years ago, you might remember that the hospital had like front page news, like overcapacity. There's no beds, and people were in the hallways, right? Emergency rooms. So we want to see what we can do to help contribute to that, like to decrease that, so that we can free up beds for real crisis in our communities. I said, hey, is any of those patients our people experiencing homelessness, and they have no place to go? They're like, yes. I go, okay, what are their needs? Like, we have one registered nurse, one practitioner, and like a part-time community psychiatrist. Like, so having that conversation with the Hilo Medical Center, they said, Brandee, we'll contract you guys to do 4 beds for medical respite. So in our field, homeless services, we say medical respite. Healthcare, when you look up the insurance billable codes, it's recuperative care. So we're both learning each other's language. He goes, oh, you're talking about recuperative care. That's what you guys do. I'm like, yeah, that's the one. So just building new relationships. So hospital now, we know each other, we can talk to each other, we're trying to figure out what we can do together. And through that is now we're working with insurance providers. So for Medicaid and Medicare, Aloha Care, Ohana Care, HMSA, I'm missing one, United Health are the folks that are working with people who have Medicaid and Medicare. We have Kaiser, but they don't work with Medicaid patients. So really working with them. And so one of that partnership that emerged was with Ohana Healthcare, and they're the health insurance that provide case management to the highest need patients in our community with behavioral health challenges. So we were working with them, and we opened up this 3rd location specifically for their patients, which is called Community Care Services, CCS. So it's a 3-bedroom house, so up to 6 beds. The other house is a 4-bedroom house, up to 8 beds. And then we have a 2-bedroom apartment, which is 4 beds. So together, in a year and a half, we opened 3 locations for 18 beds. So medical respite is one of that, where we can provide the support 24/7. And then safe places to go. So Hope Services operates 7 emergency shelters, offering 168 shelter beds across the island. Pahoa, multiple spaces in Hilo, Kailua, Kona. We're right next to the brewery block. If you go to Kona, so we're right there with the 31 units. And then we just entered into a long-term lease with Our Lady of Lourdes in Honoka'a. But actually that one's for housing. But we're trying to get to all the different places throughout the community. Yep, so we are open 24/7, 365 days a year. Do not close for Christmas. Yeah, so trying to provide those supportive spaces. So this is our Kiepua, our family shelter. The other provider who also have a family shelter is Family Neighborhood Place Apuna. So it was built by Connect Point Church following the lava eruption in 2018. And then after that, once the lava family survivors were able to find homes, then we turned that into a homeless shelter for families. So that's one. And so it's like little 10 by 12-ish units, so 120 square feet, rooms, and then there's shared bathrooms, shared kitchen, shared laundry. And then similar to Kiepua, so we have 2 duplexes. So this is the full length of the building. So two bedrooms on the outside, two studios in the inside, and then the brown door kind of in the middle is the laundry center and storage spaces. So in a two-bedroom unit, we have like 1 family each, and then they're sharing the kitchen and the bathroom. And in the studio, we put our larger families in there, or like they can have, their own private space. So it's about 10 families at Neighborhood Place Apuna, or 40 beds, and 12 families in Kihepua for 44 beds. And then there's also domestic violence shelters in our community, 1 in Hilo and 1 in Kona. And that one's like hooked up like Fort Knox, so you got like gates like locked up. You can't go in there. We can't tell you where it is. Advocates meet you out in the community and take you to the space. We also have entered into a lease with St. Joseph Church, and this is an apartment building kind of right behind Cosmic Cones. Or if you see our office in the corner, you'll see our little encampment, but it's behind there. So St. Joseph Church, we entered into a lease with them. This is an eight unit apartment unit owned by St. Joseph, but we've been leasing it since 2007. And it was our first shelter actually during Mayor Kim's first administration. So what we have there in the apartments is 22 beds as a women's shelter. One of the units we dedicate for couples. So basically one couple in each room. And no, that's not enough space because there's more couples than that. And then our first medical respite was housed here. Kilohana and Halikulike is at the old Hilo hospital up above of 34 Rainbow Drive. If you're gonna take a walk up to the waterfall where that, people ask us all the time, are you gonna make like a Halloween haunted house? Like, what's the ghost like, Brand there? So I reassured you, like I slept there myself before we opened the shelter. I said the ghost didn't bother me. Yeah, I said I just like be with me and we were fine. Yeah. And then so we walked around. Yeah, we just wanted to share that experience before we started because of course that was what we were hearing in the community. Um but yeah, since then my staff said they hear jingling or coins, but no trouble. So as long as we're all peacefully living together and unliving together, we should be fine. But it's 44 beds total on the ground level. This is our only shelter that's congregate spaces. All our other shelters is single rooms, apartment style, which is a way better setup. But at the time, we just couldn't find any place for the men's shelter, and it was just timing. This used to be Hawaii Island Adult Care, and they moved into their new building. So the ground floor, the second floor or the top floor, it used to be the county's prosecutor's office. So there's office spaces. So upstairs, we kept the office spaces, but we turned that into rental units. So there's single room occupancy, then shared bathroom, shared kitchen. So downstairs is the shelter, upstairs is rental units. And there's staffing 24/7. And some of those beds are like separate contracts. And so that's why you see that step down from Hilo Medical Center, meaning like stepping out, and also veterans with the VA. We have dedicated bed space. Sacred Heart Shelter is 20 single room occupancy. That's what SROs mean. Again, these are like 10 by 12s. It's actually based off of HPM storage design. They're storage sheds, and we just added a second window, and then changed the roof from pitch roof to lean-to roof. So you can reduce the cost. And this was built in 30 days following the lava eruption. Well, June is when we started, and July 3rd is our first resident moved in 2018. It was really a community effort of over 200 volunteers that showed up in one day. Plus, we also had the help of the National Guard, and we were very fortunate that that group was from Maui and they were the engineers. So this was my first shakeup of housing development. We had like the magnetic whiteboard, or portable ones, under the 10 by 10 tent on a plastic table, 6-foot table. Everybody like in uniform, and then like me, and then and then my other colleague. I'm like, I can't show up there by myself, so I called my other colleague who I thought knows housing, Habitat for Humanity. I'm like, can you please come because we want to do this thing, and I don't know what to do. So we're under the tent with monopoly houses. The red house was symbolized like the community center or the gathering spaces, and then the green little houses was like the units. And so they're like, okay, what does this layout look like? I'm like, no, you need this. We got to move this for security. Nobody wants to put the bathroom right in the front, put that in the back. So like having those conversations, they say, okay, we're going to put the leach fields. And I'm like, why are we having leeches on the property? Had no idea it was about septic systems. Yeah, but I was like, I just think of leeches like what I see on TV. But like those kinds of conversations, there was like, that's how our design plan went. And we showed the mayor at the time, like, this is the sketch. There was no architect plan, nothing. And he said, good to go, go. So just sign don't hold them liable, go. And then got the community to build it. It's been really a community effort. Rotary Club showed up, faith group showed up, people from the street showed up. We just put them to work. So building this and this community, a pavilion, bathrooms, and we didn't have showers. That took another 30 days, but we brought the mobile unit from Oahu because they had just did a grand blessing with Project Vision, which is a mobile unit with showers and bathrooms. So we used that for about 45 days until the bathrooms and showers were made. But that really started us to venture into, well, maybe we are capable of becoming emerging developers. But before I talk about that, other long-term housing solutions that we've learned along the way, and especially with now with the county resources, it's like there's really leasing, acquisition, construction, right? Because we haven't figured out how to preserve or figure out how to get the vacant homes onto our pipeline of like housing opportunities. But we figured out leasing, and normally leasing would be people's facilities. But we've learned from others in the nation and actually on Oahu, our partner US Fed said, Brandee, why don't you master lease? Like, what does that entail? Like, so you enter into a lease when a family or individual is not able to enter directly because of their bad credit, poor credit, whatever it may be. They don't have 3 times the income. So as an organization, we enter into a lease with the owner and then we sublet. So as long as they let us sublease, so we put like whatever insurance requirements they require, and make sure they have that language that we can sublease it. And then we sublease it to the individual that we're helping. So we're now at 75 properties in the community with managing properties. So like there's a whole nother team now of maintenance and property coordinator, property manager. We're having that conversation of like, I think we need to start thinking about like this being outside the organization, just trying to manage all these buildings and spaces. But we have a mix of supportive housing providers like us, like who manage places and spaces where people live, where they provide supports where they live. So in addition to us, Hawaii Island Home for Recovery is another organization that does supportive housing. That's the old convent house across the school from St. Joseph, across the street from the school. St. Joseph is the old convent. So they do supportive housing there, as well as we provide supports to an additional, because of the properties in the community and people who are able to enter into leases, another 300 households in the community. Salvation Army does similar programs for foster youth. They enter into leases. They can even, some of them even co-sign. So they'll co-sign with the youth. So then the youth, the foster youth can get into housing. And I mentioned Hawaii Island Home for Recovery. But there's also mental health kukua, steadfast. And then just looping back to an emerging housing developer, acquisition, construction. So through our partnership in developing the 20 SROs in Pahoa, we purchased that property from the Catholic Church. So it's 14.5 acres, and we've only used 4 acres for the shelter and this 12-unit development here. So in that partnership with HPM Building Supply, you know, they were making prefab walls and prefab trusses and all these things. And I go, you guys ever thought about making housing? Because we just lost 700, yeah, to the lava eruption. And this is already a crisis. We're already in a housing crisis helping people experiencing homelessness. So they jumped on that opportunity to figure out how to do prefabricated modular housing on island, because that's not a new idea, right? That's being done for years, centuries across the globe, just not done here locally. People are bringing other products from China, but they've been able to figure that out, how to do that here in the Keao Shipment Industrial Business District. They have a warehouse. So we built 12 modular housing units, 480 square feet. It has their own kitchen, their own bathroom. It's just a community of seniors there. In the video, you saw that we've acquired almost 24 acres in Mountain View. Our hope is to build these villages of hope throughout the island. So this is our first village, and I'm looking to do that in Mountain View. We've hired a year ago the executive director of Habitat for Humanity to work on our pipeline of housing, so we can put them in the queue, look at opportunities. We've reached out to Catholic faith groups, and now we're looking at other faith groups to see, because others also have housing or land, and see what we could do together. Yeah. And here's the mentee part. Yeah, okay. So if you have your phones, you can scan this QR code, or you can go to menti.com and you can enter that code. because they'll take you to the question. This is the first time we're going to do our breakout sessions. But if we didn't do our breakout sessions, you can actually, this will allow us to populate the answer on the big screen. But we'll do the breakouts now. I don't know how you guys want to do that. Because I'll pop up the first question. Okay. Yeah.
Kobe's like, let's try this. We've never done this before.
Yeah. I mean,
Group
learning.
Yeah, we're all learning.
So there's supposed to be, like, everybody scan the QR code and we put it back.